Welcome to an episode of TooHealthTalk, a show get to break down every health challenge in a very simple and honest conversation. On today's episode, we have a very special guest and a very controversial guest. In the healthcare system, like they have different professions, and everyone are like, fighting for their rights, fighting for their status, and all. So today we have someone that is like an auxiliary nurse that have passed through being an auxiliary nurse, and she's coming on the show to share her story. Auxiliary nurses are, globally like misunderstood, mainly in Nigeria, basically. Like they are misunderstood. That's what I'm going to say about auxiliary nurse. And there've been a lot of stereotypes about auxiliary nurse. So today I brought in an auxiliary nurse to the studio to tell us her journey of being an auxiliary nurse. And today we have
Abiodun.
Abby.
Yes.
Let's call you Abby.
Yes, Abi.
Abby, yeah. Welcome to the show.
Thank you.
How do
Thanks
you
for
feel,
having
babe?
me. Very well.
So now I know, is this your first time being like on a podcast on talking about auxiliary nurse?
Yes, yes.
Wow.
My
Okay.
first time.
Blaze up.
Okay. It's fine. I'm good.
Yeah. So now I want to ask you, like, what inspired you to go into being an auxiliary nurse?
Okay. Firstly, it was for me. It was auxiliary nurse. The title auxiliary nurse was like a starting point for me. So, but one thing that attracted me to being a nurse in general, because you have to say you want to be a nurse before the labeling, the title, and all. So, the first thing that attracted me personally was the uniform. That was the
Oh,
first thing. I just admired the uniform, the white dressing, and all. So, the second one was the attention that I get when I get care for people, like the attention aftermath. Oh, she was the one that helped me. So right from childhood, I've always loved attention. So basically, yeah, those two things.
so how did you start it? Like, how did you get to start being a healthcare professional? Like, where this stuff start from? Like,
Okay, it started from when I was staying with my aunt when I was like in junior secondary school. So I stayed with her, and she happened to be a nurse,
yeah.
and she had a chemist shop then, like a mini pharmacy. So I always go to the shop, and then I watch her sell drugs for people, care for people, and that was how I started.
So, do you think people hate auxiliary nurses?
I wouldn't say hate, maybe it's just misunderstanding. They misunderstand the role a lot.
So what's the actual role of an auxiliary nurse if everybody gets to misunderstand like the role of being an auxiliary nurse and being an RN?
Okay. Auxiliary in general, it means like support.
Oh, okay.
It's just like we supporting the registered nurses. When you are in healthcare organization, the RNs cannot be everywhere. They can't do everything. So we step in where those small loopholes we fill in. That's it. It's not like we are taking the role or we are saying we are the nurses, but then people tend to just erase us as if the role does not just matter.
So what are the most difficult challenges you've ever faced being an auxiliary nurse?
The disregard.
Disregard.
Yeah.
So how do you get to cope with that disregard? Did that get to affect the way you work?
Yes, a lot of
So
times.
what are the people that disregard you guys the most?
The RNs, oh God. The RNs, even doctors don't have much issues because I think they understood better. But the RNs, they don't just have it. They've not always, all the time, they have issues with us. So
So how do you cope with it? Like how do you cope with it?
it's crazy. The experience has been awful. It's not like a sweet one. But to me, I just knew it was like a starting point for me. It was a edge to get to wherever I'm going to in life.
So have you ever feel discouraged that I regretted like being an auxiliary nurse? Have you ever felt that way before?
Yeah,
You've ever felt that way before?
yes, so many times.
So can you give us like a story or like an example of where you felt disregarded and you felt so bad? In fact, you're like, oh, I'm never going to be an auxiliary nurse again.
Yes. Okay, there was one hospital that I worked when I finished my training. my formal training. Because when I left my own side, I went to the hospital to learn it properly. So the first hospital I worked after my graduation, I worked with RN. That particular day, I was on duty with like two RNs, registered nurses. So we had a patient in the ward, and there was drip going on and all. So the doctor was not around. So one of the nurses wanted to get food. She wanted to get herself food. Then the other one too said she was going to follow her. Then before I knew it, a patient is in the ward, and these people locked up the injection room because they felt like I don't know what is in there, or even if the patient needs help, I don't know what to do. I wouldn't know what to do. So they just, as if I was not there, as if no one was in the hospital, like on duty that day. I felt really bad, but then I couldn't confront or even challenge them. I just saw it like, okay, life goes on.
So now you talked about the training. How did they train auxiliary nurses? Like, can you tell us the process on how they train auxiliary nurses?
Yes. Okay, I'll talk about my own personal experience. We trained in the hospital. You go to the hospital, then you get a form. You paid for the training because there's a fee. You pay and you get to sew uniform. There's uniform, but you don't start wearing white. In my own at my institution, right, we wear like was it orange? No, it was not orange. I think wine color as a first timer. So you train for some particular months, then you write exam. Like after like 6 months, you watch how they give injection. My own doctor told us to buy medical dictionary, those nurses in dictionary, so that
Yeah.
we'll get familiar with medical terms and all. Then, whenever there is a procedure, they allow you to come in, maybe in batches. Sometimes, if you're not much on duty, all of us will be there. Delivery, dressing, injection, basically everything they do in the hospital. So you will just watch them do it. And if you have any questions, you ask, they explain to you. Then sometimes doctor, like it teaches us, maybe with his handout or don't, I don't know, but it teaches us, we have a note that we write just like formal training. Then after like 6 months, we write exams. We have peers, maybe people that come together the same particular that one particular time. You write exams together. Then if you fail, you maintain your uniform. But if you pass, you start wearing white. That means you've upgraded to some level. You can start attending to patients, not on your own, but at least they can send you comfortably to get some injections and withdraw and all.
So you were trained by a medical doctor.
Yes.
Wow. So now I've had people I was talking to a doctor once upon a time. She was like, "Oh, that even that she has worked with auxiliary nurses. That even auxiliary nurses they are well sound than registered nurses." Is that true?
This is experience. It's something you are seeing. I think it's different from theory, the theoretical part. This one you are seeing it, you're seeing the way they are doing it, everything. It's not like they're teaching you from the book or they're reading it out to you. You are seeing everything. So maybe that aspect. For me, I can't say that auxiliary nurses are good than I can't say.
So you think, oh, you don't have like more hands than an RN? Personally,
Like
do you think you have
hands
more
on
hands than a RN? Yeah,
experience.
yeah.
Me, I'm experienced. I'm experienced. It's not like I'm trying to blow my own, but at least I'm good because I've been into this since 2016 and I've been practicing.
Oh, you've been practicing since 2016?
Yes. So
Wow.
to some extent, yeah. I've worked with different hospitals and the doctors would just advise me, Abi, just go to school. You are good. So I've heard that a lot of times.
Wow. So now, will you advise someone to go into auxiliary nursing?
I wouldn't allow anyone to. I wouldn't advise anyone to because of the labeling that comes with it. People just misunderstand it. They feel like you don't matter, you don't know what you are doing, which in the real sense is not true. Do you understand?
Yeah.
So I wouldn't say anyone. If anyone is aspiring to be a nurse, they should go to school to get a formal training. But while at it, they can decide to go to the hospital to just see what is going on. But then they should go to
When
school.
so
Everyone should go to
when
school.
people say auxiliary nurses should not exist, like people are saying auxiliary nurses should not be like in existence for once. Do you think that's true?
It's not true. Not in the present situation of the country. The healthcare system is understaffed, and maybe in one particular duty, two RNs are on duty. They can't be everywhere. They can't do everything. There are minor jobs, minor roles that auxiliary nurses can fit in and help. So if there's collaboration, I don't think everyone should exist. Every role should exist. To me, like that's my personal opinion.
Wow. So now you've talked about like criticism being an auxiliary nurse.
Yeah.
Have you ever had a personal criticism of you being an auxiliary nurse? Because when you identify yourself as an auxiliary nurse, is there any personal criticism?
Yes.
Can you tell us what?
Okay. Honestly, I've outgrown most of these things.
Oh, like it's normal thing, and you be like,
It's not like they are normal. I just see them as what it is. Okay, this is how it's been. The only thing is just to go to school and upgrade myself. But then it's not like I've had countless experience that don't even stick to my brain. If I want to say one particular one regarding to this question, well, it's always the RNs.
always.
Always.
So your fight has been with RN.
RNs. Because patients, a patient that is sick will not even criticize you. They just want help. They want to get healed. So they don't care about your certificate or your level. They just want to be fine.
Oh,
So, and if you can render help, why not? But the RNs, oh, I go to school, you did not go to school. So you can't do this. You don't know it. It's always war.
so now I want to ask. Now people are saying like auxiliary nurses are taking the jobs of RN. Is that true? Also, because they'll be like, oh, people are employing like auxiliary nurses than RN.
I think the problem is the system. How many hospitals can comfortably pay RNs? Okay, this is what you deserve. And now, and these RNs too, the work is just tedious to settle for anyhow payment. Do you understand? So most times they settle for auxiliary nurses because they feel like can be underpaid.
So I've seen RN argue that they should ban auxiliary nurse. What's your take on that?
It's not possible. It can't be banned. Auxiliary nurses can't be banned. Like I said, they can't do everything. They cannot be everywhere. The only thing is, auxiliary nurses should know their limits and their boundaries. RNs should understand that these people are like a support system to us. Everyone should be comfortable with each other. And no man is an island of knowledge. If you are working with an auxiliary nurse as an RN,
Yeah.
and she's not doing something right, I know human life is not something you should joke with. But then before you even get to the point of you like the auxiliary nurses is the one that is going to save this patient's life, maybe to do a procedure or perform a procedure or something, the RN would come in. This is not how you do it, or she do it, he or she do the thing, and the auxiliary nurse can learn from it.
So now, before we wrap up on auxiliary nurses,
Okay.
would you give like what advice will you give to someone that is considering being an auxiliary nurse? Because I know some people now might be watching this video aspiring to become an auxiliary nurse. What's one advice would you give someone that wants to become an
I
auxiliary
don't
nurse?
think anyone should aspire to be an auxiliary nurse.
But they are doing training every day.
Yes, maybe to get started. I don't know. I don't know their reason. But for you to say, I want to become an auxiliary, like, it's the labeling alone is discouraging.
True.
So no one should aspire to be an auxiliary nurse. Everyone should save up and go to school. In my own case, it was the phone that delayed
Oh,
me.
it was the phone that delayed
It
you.
was phone that delayed me.
So if you were going to rewind things back, you want to go to.
Yes, I would prefer going to school.
So now, what are you doing now at the moment?
At the moment, I'm currently doing community health.
Oh, true.
That's true. Yeah.
Wow. True.
That's another problem.
Why did you choose going for true? Because, like, see, you were fighting with being an auxiliary nurse
Yes.
and being a registered nurse. Like, there's always fight between auxiliary nurses and nurses.
Yes.
And there's fights between choose and registered nurse. Like, how is your mental health coping with all this?
Honestly, it's crazy.
So why did you choose going for
If I
true?
had my way, I would have gone for BSc, like BNSC,
Yeah.
straight up. But it still comes down to funds. It's not free. It is
Whoa.
not free. And right now it is self-sponsored. It's not like I have a sponsor somewhere. And to me, doing this community health is growth. Personally, this is growth. And for now, at this point in my life, it is everything because I'm not where I used to be. And it's not like I've gotten to the peak of my career. I'm still growing. So I'm a work in progress. This too, too, at least it's better.
Yeah,
And
they have
there's a license and it still covers so many things. So I'm happy with myself, and then I'm still going.
So
I
generally, what
believe
inspired you to switch from being an auxiliary nurse to becoming a true?
I always want to be better. When I was an auxiliary nurse, I've had limitations, underpayments, labeling problem, disregard, all sort of disrespect from colleagues. So I just decided I knew I needed to upgrade. I needed to do something, but I even tried College of Nursing, Gwagwalada. I wrote their entrance exam, I think twice, and time was going. I didn't just want to wait anymore, so I needed to pick something. So I did CHU. I had option of CHU and public health, so I prefer CHU because you have to be exposed to patients, and that is what I want. That's what I love doing.
Well, so now this fight between choose and nurses, where is the fault coming from? Where's the problem coming from?
Nurses said CHUs are like auxiliary nurse. I've heard that a lot of times too. That's they are just senior auxiliary nurse. God. Nigerians are mean, but to me, everybody have their niche. Everyone has their niche. They have way to cover. CHUs covers primary health centers. And it will get to a point in your career as a CHU, as a community health, you can still be in general hospital. If you pick up like your CHO, if you're a community health officer, you can consult too as a doctor.
You can consult as a doctor as a true.
It's community health officer. That's after CHU. You pick up another course. That's CHO. So CHO's consult.
Wow,
Yeah,
interesting. This is the first time hearing that CHO
they
consult.
do.
Like, is he
It's not community health anymore. Community health is like 3 years.
Okay.
Once you are done with that, you pick up another course.
So that course that you pick
is community health officer.
Like
Becoming
how-
and coming. It's 3 years.
3 years also?
Yes, and it's not part time. It's full time.
Oh,
And then you can become an in charge of health centers, or you become a consultant in general hospital.
wow, interesting. So now, what's the like experience now that you're like becoming a professional, like having the license, becoming a true now? What's the experience like? Is there a little bit of relaxed in discrimination?
Yes, there is definitely. In fact, I can comfortably do my job, like because I work in a pharmacy. Before I used to be scared. Oh, I don't even know who is coming, and they'll ask, "What is your qualification?" And I'll be trembling. I won't even know what to say. But right now, I can say something, and my license, I know it covers this thing I'm doing. So it's not like I'm doing what I'm not supposed to do, unlike before. That we practice on fear. Right now, it's normal like that.
It's normal like that. So going back, you still want to become a Chief,
It's true.
like a community extension worker. Like, do you see the path as a good career path? So let me say, in the next 6 years now, you might be consulting, like you said, right?
Actually, my initial plan was to become a surgeon right from time.
Surgeon.
Yes.
Okay.
So I'm not stopping. I am not stopping. I know life gets better. So when the fund is there, I'm going to pick up a proper course that I want, that I really want to study. And I'm going to do it.
So which kind of
It might
surgery
not
do
be
you want to do?
medicine because of the timing and all right now.
So if you're not, if it's not medicine, how do you want to be doing surgery?
It's not, I must not necessarily become a surgeon. It's not like I'm giving up. But if you look at the timing and the circumstances surrounding everything, I'll do nursing. I've not really concluded. So I just want to do it one at a time. Let me finish up with this thing.
Do you think the fight between Jews and nurses is ever going to end?
It's not going to end as far as I'm concerned. Even nurses have issues with doctors in the hospital. They believe they are supposed to be clerking because it's doctors that clerks and nurses who just carry out the instructions. But they said no. Them too, they are doctors in their own field and they can do everything. I don't understand why it's like that. I mean, I can't say. I don't even know where it's coming from. But we grew to meet this beef on the field. So I don't know when it's ending.
So now that you are opportunity now to speak to the public now, is there any advice? Like, do you have any advice you want to give Jews and nurses, like for them to love themselves? Is there any advice you want to give Jews and nurses? Like,
Yes, my advice for everyone is to understand their role. No one should act outside their scope. As a Jew, know your limits. So we choose now, right now, because I'm a community. we there's a standing order that we practice on. Whatever we are doing has to be in the practice standing order. So now my advice for us is not to act beyond. And nurses too should not do what they are not supposed to do. Everybody should just stay within their limits. And everyone will be fine. The goal is to save life. It's not to fight anyone. It's not to beef each other. And we'll collaborate and work together. We'll be able to achieve a greater result. So that's it. And our government too should do better. They should make the healthcare system to be easy for everyone, both the patient, the nurses, the doctors, and everyone, because it's tiring and it's overwhelming sometimes.
yeah, okay. So now in your next life,
Okay.
choose between nursing, auxiliary nursing, and Jew. Which one will you go for?
I'll go for true.
You go for Jew.
Yes.
You will not go for nursing.
I'll not go for nursing. I will not go for nursing because how will I even put it? As a child now, our license covers us to open a mini clinic
Oh,
and be practicing. Yes, once you get your license, you can open a pharmacy, like a chemist, sorry, or a clinic. You can do delivery. The only thing is don't act beyond the standing order. But nurse's license does not cover that.
okay.
Yes. So when we now come to the financial aspect, we all know business and salary earner, so it's different. So personally, that's my opinion. I'll go for children from there. Or if I had the chance to go for medicine straight up, then I would rather prefer that. But to choose between choose and nursing, I'll go for true.
Wow. So anybody listening now, like if you want to choose a profession between a nurse,
Go for true.
thank you so much
You're welcome. Thanks
for coming on
having
the
me.
show. Like I so much appreciate you taking up your time to come on the show. And I believe that you were able to educate nurses, so auxiliary nurse, so true on what their roles are and where to like draw the line on and all. So thank once again for coming on the show. Please, if you want to support what we're doing here, if you like what we're doing here, please subscribe to this channel, like and share this video to someone that needs
Yes.
it.
Thanks for watching.
Yeah. See you on the next episode. Bye.